get government in overdrive, and based upon, like Rahm Emanuel says, never let a crisis go to waste, that's been on full display. Look how the other side of the aisle, they're political enterprisers. I hate to use the word entrepreneurs, but for business owners, they believe in the government as their growth business, as their cathedral. That'll help you understand what's just happened.
My guest today is Senator Mike Braun, a Republican lawmaker from Indiana. Senator Braun, thank you so much for joining us today.
Hey, my pleasure to be here.
So tell us a little bit about what you're doing here at CPAC today. What topic will you be covering?
So I'm talking about a lot of topics, but I'll be on a panel that was probably the biggest issue when I first became a senator, our broken healthcare system. It's been derailed by a couple impeachments and COVID. Still, for most businesses, that's the biggest issue they contend with because it's an uncontrollable cost. I'm fortunate that I took it on 15 years ago in my own business, made it employee wellness driven, and really changed the structure of my insurance plan, covered pre-existing conditions, no caps on coverage, cut costs significantly, and have managed to keep them in check 2% a year. Of course, I resigned as CEO of my company when I became a senator,
right.
But it is an example of what we can do to fix a broken healthcare system without turning it over to Bernie Sanders.
So something that I think is important to establish is a lot of young people don't know what Obamacare is. Could you lay that out for us and explain for our viewers who might not know?
So we've evolved over time to where healthcare consumers either want the government to pay for it or their employer. So there's not skin in the game, and they're not healthcare shoppers or consumers. I restructured my plan to be like that, whereas Obama's plan was simply to give us more government in cahoots with big health insurance and a broken hospital system that's now more and more dominated by fewer and fewer large companies. And pharma, I think we do a pretty good job of coming up with remedies, making the pill, but we drop the ball completely with how they distribute it.
Right.
So it's turned into a nightmare to where it costs us almost twice as much as it does in most other developed countries. And Democrats always don't worry about how you pay for it, whether you borrow money to solve it, and want more and more government. And we haven't knocked things out of the park through government on hardly any issue.
So I remember during the Amy Coney Barrett hearings, Democrats made a huge fuss about the Affordable Care Act, and they kept saying that if Amy Coney Barrett became a Supreme Court justice, she would just take an axe to the Affordable Care Act. Why do you think that this is such a major Democratic talking point?
Because back when Obamacare hit the streets, I think 2010, we had no plan as conservatives. We were defending a broken healthcare industry, and there's the fear, because I think your health and maybe your education are the two most important things that most families worry about.
Right.
Ironically, they're two of the most expensive things in our lives, and they go up more than all other sectors of our economy because government's so heavily involved in both of them. And they can use that because as you get older, your health care becomes probably increasingly more important than your education.
Right.
When you're younger, it's maybe education. But we as Republicans, look what happened in Virginia when we seized on an issue where the other side was out of bounds. I think that got us a governor's race in a very blue state.
Definitely.
It's an example of what we need to do if we're going to convince independents and win the presidential elections without so much effort and Hail Mary approach, is we got to have small government approaches that address health care and weigh in on education as well.
Now, you worked with President Donald Trump on healthcare price transparency, right?
I did. Trump was more enterprising, trying to do things that would say, hey, be competitive. If you're in the business of healthcare, publish your prices in print or on the web. Healthcare industry wants nothing of it because when you aren't transparent, that's how you raise prices. When your consumer isn't engaged, when you shop around for healthcare, there's enough transparency out there now to where you can save 30 to 70% on most prescriptions or most major procedures like MRIs, colonoscopies, the things that you spend generally within your deductible. But insurance companies, the healthcare industry, they don't make it easy. The plan I put in place restructured it, and that's why we not only cut costs, we've kept them in check now for 15 years.
Well, I'd also love to talk about this other plan that you had been talking about, your challenge to the Biden administration's vaccine mandate. Can you tell us a little more about that?
So when you get government in overdrive, and based upon, like Rahm Emanuel says, never let a crisis go to waste, that's been on full display. Look how the other side of the aisle, they're political enterprisers. I hate to use the word entrepreneurs, but for business owners, they believe in the government as their growth business, as their cathedral. That will help you understand what's just happened. So then you get things like mask mandates, vaccine mandates.
Right.
And now even when the information comes out that they weren't really that effective, look at all the money they cost. I led the effort when the abomination of trying to force businesses down to 100 employees, either get a vaccine or lose your job. That's government gone wild. And the Supreme Court cited that Congressional Review Act effort that I spearheaded as the congressional cue as to why they said they were going to rule against that mandate. Hopefully that's going to fall apart even for federal employees, right, contractors, healthcare workers as well.
Great. And do you have any advice for business owners, like a DC bar owner or anyone across the country that's been affected by the mandate and lost their job because of it?
You know, once that is done, sadly, a lot of those entrepreneurs, especially in blue states, in the big cities, that had no respect for the private sector, the productive economy, that's a cost that we won't get back, and that a few, and oftentimes many in certain places, had to bear. And that's the example of what runaway government can do, even through a crisis, especially when there was so much uncertainty about what the real ways that we get through it would be. That's all coming to light now.
Well, Senator Braun, we so appreciate your insight. Thank you for joining us today.
My pleasure.
Thank you. Wonderful. Thank you so much, Senator.
You bet.